The study I present today is entitled Corporate Governance and Social Impact of Nonprofits, Evidence from a Randomized Program in Healthcare in the Democratic Republic of Congo. And this is joint work with Anicet Fagnoa, who is a PhD student, Marieke Huisentrit, and Bertrand Quillin. All of them are at HEC Paris. Now, as you can probably infer from the title, the question that we are asking in this study is, how can nonprofit organizations improve their governance to increase their social impact? There's a long-standing literature on for-profits acknowledging the importance of corporate governance for firm performance and long-term success. Now, this need for governance arises from the agency conflict due to the separation between ownership and control. To mitigate this agency conflict and maximize firm value, companies can implement a wide set of governance mechanisms, including, for example, performance pay, managerial ownership, shareholder power, and much more. Now, if you think about it, this entire literature is really on for-profit organizations. But what about nonprofits? How can nonprofit organizations improve their governance? Now, I guess I don't have to tell you that nonprofits differ from for-profits along several dimensions, and the most obvious difference is that nonprofits don't aim to maximize firm value, but rather social value. Secondly, nonprofits are subject to a so-called non-distribution constraint. That is, nonprofits are not allowed to distribute profits to donors and employees, but rather need to reinvest them into the social objectives of the organization. And so a direct implication of this non-distribution constraint is that nonprofits do not have owners. That is, investors who fund nonprofits through donations have no claim on nonprofits' revenues and assets, no control rights over the organization, and they are not the beneficiaries of nonprofits. Accordingly, many of the governance tools that are available for for-profits, such as pay for financial performance or managerial ownership, they're not available for nonprofits. And so this begs the question again, how can nonprofits improve the governance to increase their social impact? Now, answering this question is important from both an economic and social perspective. First, the nonprofit sector represents a large part of the global economy. To give you a sense, about 1/3 of total employment in the social sector is provided by nonprofits. In the US, this corresponds to about 9% of total labor force. Second, every year, large amounts of funds and efforts are invested into nonprofits in the pursuit of social and environmental objectives. And so accordingly, understanding how to efficiently use these funds is important, not just for the nonprofit organization per se, but also for donors and impact investors who aim to make a difference in this world, and perhaps most importantly, for the achievement of the UN Sustainable Development Goals, which includes, for example, no poverty, zero hunger, gender equality, the development of sustainable cities, climate action, the protection of life below water, life on land, etc. Now, in this study, we focus on one specific SDG, and this is good health and well-being. When it comes to global health, there is no doubt the major progress has been made over the past decades, but stark disparities still remain. And in particular, sub-Saharan Africa remains the region with the highest infant mortality rate. To give you a sense, about 8% of children die before they can celebrate their 5th birthday, and 7% they don't even survive the first year. And so these numbers are about 14 to 15% higher than in countries such as France, UK, and the US. Now, in this study, we focus on one specific country in sub-Saharan Africa, and this is the Democratic Republic of Congo, which is, sadly speaking, among the countries with the highest infant mortality rate. So you can see it here in dark blue. And we examine the effectiveness of the governance program in the context of a randomized governance program that was implemented in the healthcare sector of the DRC. About 1,000 nonprofit health centers took part in this program, and they were randomly assigned into treatment and control group. Only the treatment group received the so-called governance treatment, which consists of pro-social incentives and auditing. And in a short little while, I'm going to describe a little more in detail what these pro-social incentives and auditing entail, but for now, just consider them as governance mechanisms. Just in case I'm running out of time, let me already share a preview of the results with you. So we find that the adoption of this governance bundle consisting of pro-social incentives and auditing leads to higher operating efficiency as measured by an increase in health services provided per employee, and it also leads to improved social performance as measured by a reduction in stillbirths and neonatal deaths. For those of you who might be less familiar with these terms, so stillbirths refers to babies that are born dead or die already in the womb of the mother before the birth, and neonatal deaths are those babies that are born alive, but they die within 28 days after the birth. Then we also find that the density of peer organizations matters. Specifically, we find that the governance is more effective in regions with lower density of peer organizations. The idea being that the closer located they are together, the easier it is to share important information knowledge with each other, and the higher is the competitive pressure. As such, there's less of a need of governance. And last but not least, we find that funding is unlikely a substitute for governance. That is, health centers that only receive funding, they increase their scale, so meaning they hire more employees, they provide more services, but they don't manage to improve their operating efficiency nor social performance. So overall, these results suggest that pro-social incentives and auditing play a key role in achieving the nonprofit's objectives and increasing the social impact of the funds invested. So here's the rest of the agenda. So next I'm providing you with a very brief theoretical background, then I'll discuss the data methodology, go over the results, and last but not least, I will conclude. When it comes to nonprofits, there are two key governance challenges that nonprofits are facing. And the first one, and this is actually very similar to for-profits, is that they are likely subject to a potential agency conflict, that is the misalignment of interests between nonprofits and the manager, which may lead to an inefficient use of resources and undermine their ability to pursue their social objectives. Given the uniqueness of nonprofits, many of the governance tools that are available for for-profits are not available to nonprofits. In fact, if you would incentivize managers in nonprofits based on financial performance, this would rather misalign their interests with profit maximization as opposed to aligning them with social impact maximization. The second potential governance challenge that nonprofits are facing, especially when it comes to low-income countries, is that managers and employees may simply lack the necessary knowledge and expertise in understanding how to improve their operating efficiency and quality of services. Now, in the following, what we do is we examine the effectiveness of one specific governance bundle consisting of pro-social incentives and auditing. Just to be clear, we are not claiming that these are the only governance mechanisms that are potentially available for nonprofit organizations, but these are the governance mechanisms that we are examining in this study. So, in terms of pro-social incentives, what are these? Well, this is additional funding that is provided to the nonprofit organization based on its social performance, such as the achievement of predetermined social targets, adherence to specific guidelines and best practices, and the conformity with quality standards. Now, this additional funding in turn allows the nonprofit to, for example, upgrade its equipment, provide training to its employees, extend the scope of services, etc. You can see two key differences between these pro-social incentives and the more traditional financial incentives that we know from the for-profit sector. First, pro-social incentives are linked to the social performance of the organization as opposed to the financial performance. And secondly, pro-social incentives, the direct beneficiary of pro-social incentives is not the individual, but rather the organization. Now, we expect that these pro-social incentives have a positive impact on individuals' work behavior for two main reasons. First, and this is more an indirect channel, that by providing pro-social incentives, nonprofit organizations can leverage the intrinsic motivation of their employees to obtain additional funding for their social causes. And secondly, this additional funding allows the nonprofit to improve its equipment, to provide training opportunities, etc., all of which increases the attractiveness as a workplace. Now, in addition to pro-social incentives, we also expect that auditing plays an important role for the following reasons. First, and this is the more traditional role that we understand under auditing, is that auditors can verify that indeed best practices and protocols are followed adequate priorities for resource allocation are set, a strategic plan is developed, etc. In addition, especially in this context, auditors play an important role in providing feedback and recommendations to nonprofit organizations. And as such, they serve as informal coaches to them. So in sum, we expect that this bundle of pro-social incentives and auditing likely serves as an effective governance mechanism for nonprofits and hereby helps improve the operating efficiency and social performance. All right, now let me get to the data. So as I mentioned before, in this study, we focus on one specific SDG, and this is good health and well-being. In the context of the DRC, for those of you who might be a little rusty in terms of geographic knowledge, the DRC is located in the middle of sub-Saharan Africa. You can see it here in green, and it is divided into 26 provinces. Here you have some pictures of health centers in our data. You can see that these are relatively small health centers. They only provide primary health care, mainly related to mothers and infants, and they only have very few staff members on site. In fact, most of them are nurses and admins, and only about 8 out of 100 health centers have a doctor on site. So clearly, this is not the Mass General Hospital in Boston. All right, let me now introduce the PDSS program. So the PDSS program stands for Le Projet de Développement du Système de Santé. It is administered by the World Bank in the DRC, and it started in the first quarter of 2017. The aim of this program was to develop the healthcare system of the DRC. And 13 out of the 26 provinces participated in this program. Now, just to be very clear, whether a health center is part of this PDSS program, this is not a random decision. But what is random is then the allocation of those health centers within the program into treatment and control group, where the treatment group receives both financial subsidies as well as this governance treatment consisting of pro-social incentives and auditing, whereas the control group only receives financial subsidies. And so given this randomized assignment of health centers to treatment and control group, this really provides us with an ideal setup to examine the causal impact of governance on health centers' operating efficiency and social performance. All right, in terms of coverage, so we have data from all health centers in the DRC over a period of 10 quarters. We have detailed information for each health center with respect to its operations, name, location, and there's a total of 999 health centers that are part of this PDSS program. Let me now talk about the randomization tests. So if it's truly random of whether the health centers within this program are assigned to the treatment or control group, you would expect that there is no statistical significant difference between these two groups along several observations, observable variables. And this is exactly what you can see in this table. There's no statistical significant difference between treated and control groups, regardless of whether we look at the primary healthcare service provided per employee, number of employees and the composition of employees, the type of primary healthcare services, the number of births and birth statistics. Same applies to the financials and the population statistics. Okay, so overall, this is really supportive of randomization. Similarly, here you have the map of the location of all the health centers in the DRC. The red dots refer to those in the control group, the blue dots those in the treatment group, and as you can see, there's no geographic clustering going on. Okay, they are fairly uniformly distributed across those provinces that took part in this study. Now, to examine the effectiveness of governance on those nonprofits, we use a difference in difference approach, meaning we compare two differences. The first difference is before versus after the treatment, and the second difference is the treatment versus control group. In the treatment group, we include all health centers that receive funding and this governance treatment, whereas in the control group, we include health centers that receive only funding. And to illustrate this methodology, let me walk you through a simple example. Let's assume we have Health Center T, which in Q1 of 2017, for random reasons, adopts a governance bundle. To estimate the effect of governance on the outcome variable of interest, such as number of babies born alive, we compute the difference of Y before versus after at that health center. Now, would we only consider this first difference, it's possible we would capture changes in the economic or social environment, for example, a general improvement in global health. And so to account for this, we use a control group, let's say Control Health Center C, which for random reasons in Q1 2017 did not adopt the governance bundle. Again, we compute the difference in Y before versus after, and finally, we compute the difference between these two differences. So this methodology can be implemented by estimating the following regression. On the left-hand side, we have the change in the outcome variable Y. On the right-hand side, we have province fixed effects, treatment, which is a treatment indicator that is 1 for health centers in the treatment group, 0 for health centers in the control group, and epsilon is the error term. Let me introduce the main dependent variables. So to capture operating efficiency, we compute the ratio of number of primary healthcare services provided per employee. In a sense, this is a measure for labor productivity. Then for quality of healthcare services, we use 3 measures. This is the share of stillbirths, the share of neonatal deaths, and the share of live births, which is the complement to the other 2. All right, let me now show you the main results. So we examine the effectiveness of governance on health centers' outcomes. We start with looking at the change in health centers' operating efficiency as proxied by the primary healthcare service provided per employee. You can see we find an uptick by 93 healthcare services provided per employee. So this implies that operating efficiency increases by about 35% over this time span of 10 quarters, which is quite substantial. Now, then we try to dig a little bit deeper and understand where does this improvement in operating efficiency come from? Does it come from the denominator or numerator? So we look at the change in the health center's employees as well as in the volume of healthcare services. You can see that the number of employees decreases by about 8.5%, but this is not significant. When we look at the composition of employees, so we split into doctors, nurses, and admins, you can see that the only significant change is in terms of admins. So in other words, treated health centers hire 10% fewer additional employees than those in the control group. Then when we look at the volume of healthcare services, namely primary healthcare services, the maternal and childhood healthcare services, and birth, you can see that they all increase by about 7 to 13%, but none of them is significant. So overall, this suggests that the efficiency gains are derived mainly from a reduction in administrative overhead. Next, we look at the change in the quality of healthcare services. So we look at the share of stillbirths, the share of neonatal deaths, and the share of live births. You can see they improve all substantially. So in other words, the stillbirth probability decreases by about 44% over this 10-quarter time period, and neonatal death probability decreases by about 58%. So overall, this suggests that the governance treatment leads to substantial improvements in social performance. All right. In the study, we also conducted behavioral robustness tests, but in the interest of time, I'm not going to present them here. Also, we examined the moderating role of the density of health centers and the effectiveness of funding versus governance. You can imagine that writing a check might be much more easier than trying to improve the governance of each one of these health centers. Again, in the interest of time, I will skip this part, but I would strongly encourage you to read our paper, which is posted online. Instead, let me just conclude, okay? So what do we find? We find that the adoption of this governance bundle consisting of pro-social incentives and auditing leads to improved operating efficiency as well as social performance. We also find that the density of peer organizations matters, that is, governance is more effective in regions with a lower density of peers, and we find that funding alone is unlikely to serve as a substitute for governance. So overall, this suggests that pro-social incentives and auditing play a key role in achieving the nonprofit's objectives and increasing the social impact of the funds invested. Now, as any management scholar, we all wonder, why do we care? Okay, so what are the implications really for practice? Well, we know that every year considerable efforts and large amounts of funds are invested in nonprofits, many of which aim to achieve one or several of the 17 SDGs of the United Nations, which include, for example, ending poverty, reducing hunger, promoting healthy lives and well-being, climate action, etc. So hopefully the insights of this study help inform nonprofit organizations as well as donors and impact investors about governance mechanisms that are available and effective in achieving the nonprofit's objectives and maximizing the social impact of the funds invested. Thank you.